And at this point, the federal government has been talking positively with Idaho. You know, it's sort of like we got two things going for us in a way that's good. Number one, the current Obama administration really wants to see the Affordable Act work and be implemented. And so that's a good thing. And so they're bending over backwards to try to make that work. And secondly, this is a very Republican state, so they would love nothing more to have a Republican state actually make this whole thing work. So it's a sort of a double whammy. So there's an extra incentive. It's, you know, it'd be a bigger win for him to get a Republican state to do it than the state of California. But they haven't approved anything yet. The other part of what we've looked at is how do you design the system to look at every person having a primary care medical home that works with persons, monitors their care over time, coordinates care with specialists and providers, having networks that really look at people talking to each other and have electronic systems. You know, there's a lot of data. For example, a study of Medicare patients. So most Medicare folks have an average of 7 different physicians, most of whom don't talk to each other. And so there's lots of room for errors around medications and other kind of things. So how do you coordinate and get care done in a seamless kind of a way, and shift the payment model from volume to keeping people healthy? So you may pay a healthcare entity for X amount of dollars for a person with diabetes, and it doesn't matter whether they have to have an in-office visit or you can handle it by email, secure email, or doing how you ever do it. And then having the systems to really look and see, does this work? Healthcare systems are going through this process because this is happening, and folks are trying to figure out how to make that work. So the Medicaid expansion group said, okay, we've looked at the numbers. Yes, it's important. Let's look at paying people differently so providers are not incentivized just to run the numbers and run the table, but let's also try to get people involved in their own health, and people get rewarded for trying to be healthy and stay healthy. So we're trying to balance all of those elements to make something work. So I just want to remember what the Idaho eligibility looks like today. And what we're talking about is these folks down here, and what's the impact at the bottom of the list. So there's some things that have to be done no matter what, starting in January. The feds changed the rules on how Medicaid determines eligibility. It's sort of complicated, but there's a sense because of all the push to enroll people, more folks will know about eligibility, more folks will apply. People who've got kids that would be eligible would come out, they call it coming out of the woodwork. So there's about 45,000 out of that 275,000 of people who probably will be eligible for Medicaid. All they've got to do is apply. So that's not a bad deal. Now, some people have chosen not to apply because it's Medicaid, a lot of different things about that. But people could come in and apply. There's about 45,000 people who would fall into that category no matter what the state does. So if there's optional plans, so this is the people between 0 and 138 that aren't covered under Medicaid any other way, the legislators are going to have to make this decision. It covers families, covers adults earning below 138% of poverty. So a family of 4, that's $32,500. Still not a lot of money. Covers adults age 19 to 64. Folks must be a legal resident and can't be in prison. So if you're up on the Hill in the women's prison, you could apply, but you're not going to be eligible. You get out, you could be eligible. So there's an estimate that in this population, there's over 100,000 adults that would be eligible for care if Idaho so chooses to do that. And if you look at that, the annual income for an individual that would be eligible could be up to about $15,000, $16,000. It's not a lot of money. For a family of 4, it gets up to $32,000. When you start thinking about family of 4 and living expenses today, that's still a pretty Spartan living environment.
The school teacher.
Pardon me?
The school teacher.
School teachers make $30,000. Yeah, school teacher. If you had a school teacher who was school teacher that did not have had 3 kids, would be eligible.
Already on food stamps.
Yeah, probably on, yeah. So school teacher salaries fit into this if you have, or a school teacher and a spouse, and the spouse maybe was going to school and not working, you'd meet this requirement. So, when you start, the pieces sort of start fitting together.
The mother is incarcerated. The children would qualify.
Yeah, if mom's incarcerated, mom would not be, but the children, whoever was caring for the children would be eligible, probably out through the Children's Health Insurance or Medicaid program. Mom obviously is not going to be making much money while she's in prison.
But
And she's getting health care when she's in prison, basic health care. The quality of that sometimes may be questionable, but she's getting health care. So if you look at what's going to happen in January of 2014, right now, the way things stand, the health insurance exchange makes subsidized health insurance available to all the people in pink. So starting in January of 2014, you can go through the health insurance exchange, and based upon your income and family size, you will get an advanced premium income tax credit that will go to help cover the cost of your premium. And if you're below 250% of poverty, you'll also get a subsidy to reduce your premium and copay amounts. So everybody, essentially, if you look at this, everybody but this little category over here in January of 2014 has the ability to get health insurance. But if you're a low-income adult in Idaho, you're out of luck. So if we don't expand, you're a low-income adult below 100% of poverty, there's no coverage. If you're between 100 and 138, you fall into the category that could get funding through the health insurance exchange, so there's a little bit of benefit if you're just above the number. And if you have kids in the family. And we, at Health West we saw lots of situations where the kids were covered, the adult is not covered. So if you have kids and you're between 26% of the federal poverty level, so if you're making a little more than $3,000 a month, a year or higher, you're still out of luck. So what if we do nothing? So what happens to the state over the next 10 years if the status quo continues? So the status quo continues. The estimate is it will cost about $394 million to cover the people that are eligible for Medicaid but haven't applied yet but might apply, and that's assuming everybody does it. In the meantime, over that next year period, the state catastrophic fund that covers the high-cost claims is projected to have a cost of about $539 million. Mental health services will spend another $110 million. The counties will spend another $478 million. Yeah.
There's one other financial category that goes along with the catastrophic fund, the indigent funds, and that's hospital charity.
And there's hospital charity care.
Yeah.
And
that adds up too.
That's a whole other bucket. And there's another impact on the Affordable Care Act that we'll talk about in a little bit about hospitals. Hospitals did a bargain that they thought was going to work out, but it's backfired. And so the counties, so the cost over the next 10 years of the status quo is essentially $1.5 billion over the next 10 years for doing things the way we're doing it today.
Plus a loss of life projected at about 650 people a year.
Yeah, so that doesn't count the physical health impacts, the fact that we know that people die. There's a number of people that will die every year because there's no health insurance. There's a cost to insurance premiums because hospital charges go up a little bit to cover the cost of uncompensated care. So everyone who has health insurance, a bit of your premium covers the charges that a hospital includes. So, because hospitals don't stay in business if they keep losing money. So, and this doesn't, the federal match rates aren't as good. So we know if we do nothing, we have a pretty healthy cost. So what if we do, and this is just a nice little chart that shows how that cost will run over 10 years. If you like to ski, that wouldn't be a bad slope to run down. It'd be a hell of a downhill run. Yes, it would. Pardon me?
It'd be fun to go down if you had health insurance.
That's right, if you have health insurance, because you sure don't want to break your hip or your knee, you know, or blow a knee out while you're doing it. So what if we do the expansion and do an optional enrollment? So what does it do? So we know that over a 10-year period, just to administer the program and handling some claims, you've got a cost of about $650 million. So you got that cost. Well, then all of a sudden the state saves about $650 million because it doesn't have to pay for the state catastrophic fund. The folks on mental health care that the state pays out of general fund get paid for out of this program. The states that this Department of Corrections paid for in terms of health care out of state general funds get paid for out of this program. So the state saves about $650 million of current cost. The counties save that $478 million that they've been paying out in county medical indigency. So over 10 years, you provide coverage to about 104,000 people instead of less than 10,000, and you save $480 million. So that's, if you do this, you get that kind of a savings.
Well, and then you take the financial impact of that. You have 104,000 people that are healthier that can work, which contributes to the coffers of the state. So it all goes hand in hand.
You get a very, and it gets bigger than that, really. So basically, yeah, if people have health insurance and they are healthier, you have a healthier workforce, which helps drive the economy. So it really becomes, which way do you want your spiral to go? You want it to go up or do you want it to go down? That's the choice of the state.
But what's the resistance to it?
So, politics.
Because it's Obama?
You're asking me? Susie, you've just gone through this.
I know.
No, I think that